I think stem cells have been around for many years now. I mean, initially a lot of people were more into things like animal cells, sheep and rabbit cells in Germany, Switzerland, many years ago, and that's been going on. But now these human cells are there, and there are a lot of countries that we are already doing a lot of research in stem cells, and it's looking at very promising. Like we already discussed earlier, osteoarthritis is already a product in countries like India, Korea, and I heard even in Singapore, and even in Malaysia, we're already into phase 4 trials with osteoarthritis. So if stem cell can regenerate your cartilage, can you imagine what else it can do? So I think and we also know it's a safe therapy. That means all phase 1 trials for safety have already, a lot of countries have done that, and we know it's safe. Treatment wise is where the focus is. A lot of focus on whether stem cells can actually treat diseases in our body, whether fatty liver or it's a pancreas dysfunction, or whether it's a kidney issue or the lung issue or heart or brain, right? This is all the research that we are looking at. So we know joints, yes, great, but can also stem cell treat many other diseases, and that's where a lot of research is going on. Of course, this will take time to see if disease can be treated. The other thing is which cells should be used and how much the quantity, how often need to do. So this is some of the things that we have to look at stem cells. Most of the time stem cells have been used a lot of places in the world is that more for wellness, for prevention, where people feel they want to do something extra to make them live longer, have a healthier lifespan, and that's where stem cells are there more for wellness. But now a lot of the research is going into disease, and that's very exciting, because if stem cells can cure disease, a lot of times people are going to age better. The use of drugs and hospital admissions and surgeries might become less. So that's very interesting. So we know that osteoarthritis definitely works, but there's a lot of excitement about whether it works for liver. Anything that causes inflammation and degeneration, in the organ, potential for stem cells to work is definitely there. Looking at strokes, Alzheimer's, Parkinson's, looking at lung fibrosis, liver fibrosis, same with pancreas, kidneys, your bones. So all this is the potential is there. They also believe that stem cells might help to modify your immune system, so that even things like autoimmune disease might be actually help stem cell therapy. But all this is still under research. It's exciting, that even studies coming out that it helps diabetic patients, if not cure, but at least reduce the drugs for diabetes or insulin. A lot of potential. Still, we have to wait and see for the research, but I think very exciting that where we are heading with stem cell therapies. For preventive, I think we know that after 40, your stem cells numbers will decrease, and of course every decade after that it becomes less and less, and then even if your stem cells are there's stem cell exhaustion, so they may not work as effective. So we do look at cutoff of 40, but of course there are patients who got a very unhealthy lifestyle, already got metabolic diseases, and they want to come to us earlier. But I always suggest that look at their lifestyle first. That's the foundation. Don't just use stem cell therapy alone. This must work hand in hand with lifestyle, supplements, and then stem cells. One of the important things that you understand in this therapy is we're looking at a patient, one is as a whole, and you're looking at the person, and you shouldn't call them patient, you call them as a person for the long term. We are there to look after their health for the long term. It's not a one-off thing. And I think what a lot of places initially when I was involved with stem cell therapy in the beginning, we all were very excited, so we also didn't know. And what people did was they got someone, they gave them stem cells, and that was the end of it. The person was left hanging, didn't know what to do after that, and that's where Laureate is very different. First, we do a full blood profile just to assess you. We do a full clinical assessment, and then from there we know that what are the things best for you. So it's not just the stem cell therapy, it's also things like vitamin infusions. We look at detox, we look at other infusions like NAD, we look at what supplements will support your body, and it's a program. It's a whole 1 year program, and some of our patients have been with us for many years. So it's looking after the health of someone for the long term, right? It's not just giving them some therapy and then telling them thank you. It's not that. You get a disease like diabetes, you go and see the doctor, it's a long term. The doctor sees you every few months, checks your blood sugar, then adjusts your medication. But I think the same thing should look at wellness. It's something that you should be continuously monitoring with the help of an expert. It's not just a one-off thing, and I think that's where we stand off. Laureate is looking at that long-term assessments, long-term treatments to look after your health so that you can live long, live well.